When I first saw this, I was disgusted. When I first saw this, I was like, you're removing healthy papilla. You're going to destroy the biological width. The patient will die. The patient will get necrosis, all these things. Have you ever had that scenario where you got your matrix band in and you got this lovely looking contact area and you're thinking, great, this is going to be a home run restoration. But then you put in your wedge and okay, the whole contact's now open, right? The matrix that was beautifully contacting the adjacent tooth before is no longer contacting that tooth. What's happened there and how can we overcome this really simple, basic, but daily bread and butter issue? I've got none other than Maciek Czerwinski, who obviously came on to do an amazing episode all about matrix selection, like which is the best matrix, and I hope you enjoy that episode. So today, we're going to be talking about these class 2 woes. Do you make these class 2 mistakes? We're going to be talking about the importance of recognizing how to overcome this issue that as soon as you put a wedge in, the contact area opens. Or the second scenario is the importance of soft tissue removal. Like I couldn't believe that when I spoke to Maciek, he revealed that in 70% of his class 2 cases, he's having to remove some soft tissue. Now, if you've seen some of his work on Facebook, you'll see why. He's dealing with some pretty deep lesions the whole time. So that makes perfect sense. And he gives you one more pearl as well. So welcome, Protrusive. I'm Jazz Galati, to this group function all about how can you improve your class 2 contacts and how to overcome common scenarios. We'll catch the main episode and I'll catch you in the outro. And if you catch the outro, you will see a massive discount on Maciek's class 2 course. It's called Contact Point Ambassador. It's way more than a class 2 course. It's like getting solid contacts consistently. So if you want to do the kind of cases he does on social media in terms of like really solid dentistry, restorative dentistry, without never having open contacts again, from all the different types of rings, Teflon floss, matrices, and the whole sort of dissection of it, for the cost of one restoration, you can do his course with this 50% off. So catch that in the outro and I'll see you there. Maciek, aka Magic, welcome back to the Protrusive Dental Podcast. I had to bring you back one more time, my friend, because you absolutely blew everyone's mind when we talked about which is the best matrix system. How are you, my friend?
Thank you. I'm fine. Thank you for the invitation. It's a big pleasure for me to be with you second time. Nothing really big change, except I did something for the very first time. I launched my first online course and I was very happy about it. Also a little bit nervous because it's a little bit nervous when you do something for the very first time, also like in dentistry. But yeah, everything is really great. So thank you.
I'm so glad you did that because Maciek, as someone who creates online education myself, I was waiting for you to do that because the amount of value that you give on your social media posts, I was waiting for something a bit more structured, and you finally did that, and I was happy to say I was one of the first students, and thank you for giving me the opportunity to work through it. And oh my God, from the Teflon floss to matrix selection to wedge modification, you covered everything beautifully. But today what I want to do is extrapolate, maybe just pinch, squeeze out of you some gems that can help everyone, right? So this is today, it's the Protrusive Dental Podcast episode, but it's also like a group function, okay? A group function is what I do when we have a problem in our community, the listeners, and they have a problem and they need the answer to that one specific problem. And that problem at the moment is a contact points, right? So the reason I got you on is because who better to get you on, Maciek, because your course is called Contact Point Ambassador. So great name. And I think the times as a dentist where I felt the lowest after a clinical day is when in my mind, I cannot get rid of that stupid, silly open contact, right? You try your best, you do everything, and you're still left with an open contact, right? It's not nice. It's not a nice feeling. And sometimes you think, could I have done something better, or was that impossible? Now, I know in your vocabulary, there is no such thing as impossible. I've seen any contact. I've seen you've closed it. But what I also appreciate, by the way, for those who don't know, is that you share your failures, your past failures, and how you've learned and adapted, which is why it sets up perfectly to the first question, Maciek, which is that annoying scenario whereby you put your matrix in. So this could be a circumferential matrix or a sectional matrix, right? You put the matrix in, okay? You're sealing the cervical area of the cavity. So remember, we're on video, but we're also, for the audio listeners, we need to be very descriptive what we're describing, okay? So the matrix has a good seal, and the matrix looks like it's got a nice contact to the the adjacent tooth, which is good. But as soon as you put the wedge in, the contact is gone, and now you have like a 1 millimeter open contact. What are we doing wrong when this happens, and what tip can you give to the dentists who are having this problem now and again?
Yeah, probably this is one of the most common problem, and that was also my problem for many years. And so I know this frustrating moment when you see it, especially that very often we don't have enough time to correct it, and it would be super if we have some solution for that. And that was the beginning of the idea of the Teflon floss. So the biggest problem is the fact that the wedge is a stiff material. So if you use the plastic wedge or the wooden wedge, very often those wedges are just too big or they're moving just too close to the occlusal surface, and this is the biggest reason for losing the contact point. So my advice would be to try to use the Teflon floss, because Teflon floss just is a game changer, because this is something that we're gonna adapt to the space. That is the interdentally, and it's pretty soft at the beginning. So if you've got the matrix with some kind of the curvature, if you use the stiff wedge, suddenly if the wedge is too big, it will just move the matrix. But if you've got something soft, Teflon floss will go under the curvature of the matrix, and then it will just self-adapt. So if you are using the stiff wedges, you always have to customize it. So you have to cut it, so you have to reduce it from its height, or you have to cut the plastic wedges. That is pretty time consuming as well, because as you know, because we also have to customize very often our matrices. So there is so many things to customize that suddenly it turned out that there is no enough time for finishing the whole thing. So Teflon floss make everything much easier. However, you have to learn how to use it, like with everything.
Well, those people listening right now who maybe didn't catch our first episode, we discussed Teflon floss at great depth. Essentially, it's floss much more intricately than what I'm describing, but wrapped in Teflon. And essentially, you get like a softer wedge that can get a really nice seal that is adaptable. And, you know, I'm definitely sold on the Teflon floss. And I believe you released a video recently as a preview for your course. And I'll add that on my website so people can check it out, how to do the Teflon floss. And then they can start seeing the advantages of switching to a Teflon floss rather than a stiff wedge. Now, the issue that I described, where, you know, you stick your wooden wedge in and the contact opens, do you think that also happens not just because it's a stiff wedge, but maybe because the wedge is too coronal? I.e., it's not deep enough, it's not gingival or cervical enough. Could that be a cause of this issue as well?
Sure, that's another reason. So this is why it's very easy when we've got pretty shallow cavities, because then the wedge will go always under the curvature of the tooth. But if you are pretty deep, then it will always move. One of the solutions is definitely to remove the gum, so to create more space for the wedge, because it's impossible, if you've got a lot of the gum interdentally, it's impossible to squeeze all that tissue with a wedge, or you have to use very big force that will be not very pleasant for your patient, especially if you work without anesthesia, but probably not. But sometimes it's really necessary to remove the gum. So probably in my cases, like the second class cases, almost 70% of the cases, I will gonna remove the gum. So this is like the really essential element of the restorative treatment when we talk about the class to remove the gum, because then it's much easier, not only with the wedging, but also with the matrix placing, with the rubber dam placement. So a lot of the advantages of doing that.
There are so many advantages of removing soft tissue, and I believe it was you and Pasquale Venuti who I first saw on social media many years ago, removing soft tissue. And you know what, Maciek? When I first saw this, I was disgusted. When I first saw this, I was like, you're removing healthy papilla. You're gonna destroy the biological width. The patient will die. The patient will get necrosis. You know, all these things you think. But man, when I started to do it, wow, the rubber dam started to seat more apically. My matrix was able to seat and get a better cervical seal. My wedge finally had the correct position to go to, right? So there are so many advantages of soft tissue removal. It did surprise me that 70% of the cases you're removing soft tissue, but then again, if you look at Maciek's population base and you look at the kind of caries bombs that you get, like they're always so deep, and then I think that's because you're having to remove the gum because you're dealing with really deep lesions. So it makes perfect sense. Now, the most common question people are thinking now while we're talking about this is, okay, what do you got to use, a laser or what? I mean, I know what I use, but I want to hear about what kind of things do you use to remove the soft tissue in an efficient way, in an idiot-proof way.
Sure, I was trying almost everything because for me it was also like the complete switch of my approach in the restorative treatment. So even that I wanted in the past to be a surgeon, I really don't like to use a blade during the restorative treatment because, you have to tell to your patient why you are taking the blade, why you want to cut him, and it's not so easy. Also, the whole management and all the manual connected with the using the blade, it's not so easy, especially when we talk about the interdental space. So for me, when Pascal Venuti showed for the very first time this magic burr that is not covered with the diamond, this very smooth burr that you can really easily remove the gum, that was the completely switch for me, and it's really probably the best possible option to do that. I was trying also the laser. However, to be honest, I'm not a fan of laser, especially in this area, because you never know how deep you will gonna burn the tissue with the laser. So the friend of mine sent me a message that he made the bone necrosis because he was cutting the gum, but it was just too deep, so he also cut the bone. So for I also like to have like very simple protocol, and using the burr is just the easiest solution for us because you can just put the burr into the handpiece, into the turbine, and you can remove it. So this is also a very important factor to use something that is very, very quick. Because also I was using the cauter, the electrosurgery in such situations. However, it's not always ready, so I had to ask my dental assistant to prepare it, and then if something lasts more than 3 or 4 minutes, you will probably resign using that. So the burr is the easiest, the quickest, and probably the best possible option to do that.
Well, I've used electrocautery. First year out of dental school, I started using electrocautery. I wish I knew at that stage about matricing and getting the best seal and stuff, and I suffered a lot at that time, as you do when you're a learner, right? And then I would use electrocautery when it's like really deep and I had no choice. But then I also use a laser, but I agree with you. You don't know exactly the depth that you're penetrating the soft tissue. But when I switched to the thermocut burr, this burr without any diamonds, and they come in, the one I recommend to buy if anyone's going to buy it is you have an assorted set of like 5 different sizes, 6 different sizes. That's the best one because you get like tiny one for really tight spaces and a fat one for really fat spaces for really meaty papillas. And you just put that on high rev, no water. And I just love just, all that papilla comes away so precisely and very minimal bleeding, painless. And obviously as part of this, you're doing anesthesia anyway for your class 2 restoration. And I'm giving a little bit in the papilla, buccally going all the way. And it's just a great way to do it. So it's a thermocut burr that really made a huge difference. And yeah, you're right. If you're completely right, like if you're going to be using electrocautery and if you already have this expensive system or laser and stuff, then to actually tell your nurse, oh, can you please get it, wait for it to set up, when you can just stick this burr in, it's so good. And what do you say to patients like we're having this papillectomy for afterwards and aftercare? That's the most common question I get as well.
Yeah, that's a very good question, to be honest. Definitely, in the past, I was telling to my patient before that probably we were gonna have to cut the gum. Right now, when I'm doing it with a burr, I even don't mention it before because sometimes we will make patient more stressful, and we know that it's nothing really big. So very often they will not even have pain after the visit, but it's very important to say it after the visit. So I always said that they should take some painkiller, that they can feel some pain afterwards. However, in 90% of cases, they feel just nothing. So on the next visit, when I ask, do you have any pain after the previous visit? They said, no, it wasn't painful at all. So, but there should be always the information. Also, what was pretty important for me, and this let's treat it as a hint. I always had a problem with making my prices a little bit higher. So if we are using the gingivectomy, at the beginning I was telling to my patient that we'll have to make some extra surgery because of the filling, and they will have to pay extra for this. So for me it was much easier to rise my prices because I just added the price for the gingivectomy. So that is the best possible business because you know how easy it can be and how quick it can be. But this is also one of the options how, if you don't know how you can increase your prices, this is also one of the solutions to just divide the whole restoration into the restoration and the gingivectomy. Right now, I don't have this problem, but in the past it was a problem for me. So it was a really useful trick, let's call it.
And that's important to discuss, because when we're less experienced, we're a bit more shy to charge, and we have that whole dilemma about charging. So you're right. You can say to the patient to add value to a treatment, saying, you know what, this is a tricky one. It's the hole is under your gum. I need to perform a very small surgery. Don't worry, Mrs. Smith, it won't hurt very much. You'll be numb. You won't feel anything. And then you're right. Afterwards, I find that patients hardly feel a thing. Now, some things that I do as a precaution, and there's zero evidence for this, Maciek, in terms of what I say, but I do follow, like, as if someone's had a crown lengthening surgery, the similar advice that we might give, like, don't do too much aggressive flossing there, let it heal, do some warm water salt rinse. And then one more thing I say, actually, which is like a funny thing, right, is that just before I do it, because I'm using no water, using it dry, I will say to the patient, it will smell like a barbecue, don't worry. And we just laugh about it, right? And it's a fun little thing to say as well, just before you do it and stuff. So yeah, absolutely, use a thermocut burr, remove soft tissue where it's appropriate, and you will find so many benefits of doing that. And you can get the thermocut burr pretty much worldwide. I believe it's made from Dentistry. There might be some fake ones out there as well, whatever. It's just steel, right? It's just diamond, no diamond on it. It's a very simple thing. So Maciek, I'm going to end this group function now by just asking you, can you just give us one more, because you mentor people and you teach on this all the time. What is a common dilemma that you find dentists are doing, as well as the ones I told you already, like the lack of soft tissue removal, the wedge getting in the way and removing your contact? One more issue that you think that we could have a little trick, a little gem you can give us to help improve our contact areas or contact points?
I think that one of the most important part also that I didn't know for many, many years is to prepare our visits to make the restoration. So, in the past I thought that we need some preparation only when we are doing this digital smile design and so on. We have to plan everything. But to be honest, it's also very important to check how much space do we have for our filling. Because very often when we deal with the very old fillings, sometimes the one tooth overlaps the another one. And then it's very important if you see on the dental checkup that you will have to make the restoration on the next visit and there is a really small amount of space, or there is a very flat filling that is almost connected to the neighbor tooth. Sometimes it's much better to place the ortholigature in between the teeth just to create more space. Because when we talk about...
Like an ortho separator, right?
An ortho separator, or there is something like widget to make the rubber dam more stable. So this is just a piece of the rubber. So like with the gingivectomy, we've got some surgery. Here we've got even some orthodontic connected with the restoration, because the most difficult, at least for me, is the situation when we've got very small amount of space in between, because then any matrix will be good. So then we will have to use like the stripe, and it will just make our contact point very, very bad. So it's much easier if we've got more space than if we've got just a little bit. So it's much easier when we create additional space. We put just the widget for 2 weeks, and then we've got extra 1 millimeter. That makes everything much, much easier during the visit.
That's amazing. And to make it even more tangible...
And it looks so cool on the photo.
That's another reason to do it if you're not going to do it already. But to make it tangible to listeners, like something I do quite a lot of is Hall crowns. So these are like stainless steel crowns for children without any preparation. And sometimes, not always, but sometimes we need to plan ahead and create some space, because you're not doing any prep. You want this metal crown to seat. It's like a preformed metal crown, right? And that's when commonly we'd be using these ortho separators or ligatures. So just like you said, in fact, we've all seen that restoration of that premolar. Commonly it's a premolar, and it's almost like impacted into the next premolar, and you don't have any room. It's going to be difficult to floss. It's going to be difficult to give you a very nice contour. So your gem there is brilliant. Use an orthodontic ligature or a separator and put it in a few weeks before your appointment. It opens up that space, and now it'll give you better control, a better curvature on your contact, and therefore you get more chance of getting a contact area than a contact point with less deformation of your matrix. So amazing. Maciek, thank you so much. Please tell us which is the website we need to go on to check out your new course, Contact Point Ambassador. And do you have any closing enrollment or any dates we need to know, so I know when to get this podcast out as well?
Sure. I think we'll link the address to the website under this talk. But yeah, there is this special promotion that will last only this month, so till the end of the June. This is the 50% off from the original price of the course. So I believe that it's a very good moment to watch whole the course.
Amazing. That is fantastic. And then, like I said, I've done it and there are so many gems in it, and I'm not going to give away too many secrets. But one thing I want to know is, where do I buy an Elliott separator from?
There are many distributors right now. I bought a couple of them. So right now, I like to check different brands, different instruments. So right now I've got one from, like the Chinese version, one from the Japan. So there are many places where you can buy. In Poland, there are, when you type the Elliott separator, you will definitely find one where to buy it.
Amazing, because I haven't looked. I just was wondering, basically, because I don't know many UK dentists who have one, but I think it's time, because I'm not going to give away the secrets, because you have to do the course. I mean, there's such a beautiful way to use these in a really clever way. I mean, I'm not going to give it away with a Teflon floss as well. Like, you'll never have an open contact ever again. And it's just, that's our bread and butter. And for the cost of privately, for the cost of one restoration, you're putting on a whole masterclass on contact points. That's an amazing value. So, okay, that's putting it very tight for me. So now, as we're recording this, is June 24th. By the time this episode comes on will be Monday, okay? So you'll have around about 4 or 5 days to get this discount. But honestly, even if the price rises, it doesn't matter. It's a fantastic course. You should do it, but definitely check it out. I'll link the website in the outro if I can, or if not, it will definitely be in the website as well. So it'll be protrusive.co.uk/contact points. I'm going to make it contact points. There we are. Thank you so much, Maciek, for your time. I really appreciate you coming on again and giving so much value.
Thank you, Des.
Well, there we have it, guys. That was Maciek Czerwinski on this group function, all about how to improve your contact areas and contact points and how to overcome these common challenges. So takeaway points were: make sure you modify or select an appropriate wedge, something like a Teflon floss, which he covers really well. Now, as promised, if you're watching the video version on the website or on YouTube, I've got a link to how to do the Teflon floss so you can do it in full. And it's really, it's a little bit fiddly at first, but once you do it and you see that beautiful contact maintained, it's awesome. The importance of soft tissue removal. So again, I will link you to the thermocut burrs. They are brilliant. Every practitioner should have a pack, a multi-assorted pack of thermocut burrs. And of course, the ortho ligature tip was absolutely fantastic. Now, if you want to take advantage of this discount that Maciek's offering, 50% off before the end of June, please go to protrusive.co.uk/contact point, all one word. That's contact point, and I will take you to exactly where you need to go to take advantage of this offer to do his amazing Class 2s and contact point course. I'll catch you in the next episode of Protrusive. Thank you so much for listening all the way to the end.